Hello, welcome my dear students and future doctors. My name is Asma Sauber Mustafa Abdurrahim. I'm an associate professor at the Internal Medicine Department at Ain Shams University. Today, our topic is history taking. What is history taking? History taking is taking questions from your patients and gaining information that will help you in your diagnosis. Before we take history from the patient, I would like to give you some tips for a good history. The main 4 tips I would like you to know are communication, trust, setting, and timing. First of all, communication. You need to greet this patient and welcome him. Smile and be kind. Be sure that you're going with this patient. Talk in simple words so the patient can understand you. Second of all, you're going to introduce yourself. Usually the patient comes to your clinic, but in your situation as a student, you're going to be visiting your patient at his bedside in the ward. So you're going to introduce yourself by saying, I'm a first-year medical student at Ain Shams University, Faculty of Medicine. I need to take a short history to see what's going on. You need to take his consent and approval. Take care. I know that it's not private, so you have to tell your patient, this is not a private place. There are relatives and other patients in the ward. Make sure that you ask, are you okay to talk in front of these relatives and patients? You should tell him that you're going to be writing some notes and you're not always going to be looking at him. Third, eye-to-eye contact. Always look at your patient, not sharply, but in a kind and gentle manner. We don't need this patient to be a little bit hesitant thinking that this doctor is not easygoing. We want you to be at his level of understanding. Be careful. You are not at the same educational level as he is. So you need to speak at his level in order for him to understand you and vice versa. Listen. You have to listen very carefully to your patient. Give him or her time to say everything he wants to say. Take care again. Listening means you're going to get a diagnosis or at least a differential diagnosis. Support. Make sure that you support the patient and make him or her feel that you understand him and hear his complaint and empathize with him so he feels that you are with him at every step and you're going to solve his issues. Confidence. You always have to be confident in your ability and medical knowledge as a doctor. Show the patient that you are good at what you're doing and that you understand his complaint very well and that you are going to treat the patient in the right way. Be careful. This patient has visited doctors before, have talked to relatives, have talked to neighbors, even searched on the internet. So he has come to you seeking for advice and see if you are going to convince him with something new and different in treatment that he has already heard or tried before. So you have to be confident all the way through. And lastly, control. You have to be in full control of your history-taking session. What do we mean by full control? Maybe the patient may explain some stories that he had when he was young. Let him keep talking. Let him explain. Let him discuss with ease what he wants if he feels that it's going to make him trust you and be more comfortable with you. But don't let this take too much of your time because you're still going to have a lot of things to do and discuss with your patient. Our second tip is trust. Trust is very important. What do we mean by trust? In order for this patient to give you every single detailed piece of information, he needs to know that he can trust you. Trusting you means that you must protect privacy of his information. He might tell you things that he doesn't want his family to know, his friends to know, so you must know when this information could go out and when it should be between you and him. If trust is built, then you've succeeded and you can be sure that you're on the right track with treating your patient. The third tip, setting. We said before that usually you're going to be visiting this patient at his bedside in the ward. So you have to make sure that the patient is comfortable and this is a convenient time for this patient. Maybe you went to the patient at a time where there are visits, relatives are there, friends. Make sure that this patient is comfortable talking with you in front of them. And this is convenient time for the patient to discuss his medical history. Last tip is time. How much time do you need to take history from this patient? Usually as an attending physician, you only need 10 to 15 minutes. But as a student, you can take up to 30 minutes with your patient and sometimes even longer. In conclusion, we have a goal of the patient and physician being on the same page, understanding one another, and seeing eye to eye. By following these tips, you'll be on the right track to effective treatment for your patient, because 70% of treating your patient is psychological support. If the patient trusts you, tells you all the information and details you need to know, you're on the path to treating the patient because he is convinced that he is comfortable with you and willing to be treated by you. Now you're ready to take your history.
السلام عليكم.
عليكم السلام.
أنا دكتورة سميرة في سنة أولى طب. تسمح لي أتعرف على حضرتك؟
أهلا وسهلا بحضرتك. أنا محمد.
من أي بلد يا أستاذ محمد؟
حضرتك أنا أصلي من البحيرة كده.
أحسن وأطيب ناس. أهلا وسهلا بحضرتك. تسمح لي أتكلم مع حضرتك بخصوص التعب بتاعك؟
اتفضل يا دكتور.
أنا بعد إذنك هكتب في ورقة عشان ما انساش، فمش هبقى بص عليك طول الوقت، بس أنا مركزة مع حضرتك.
مفيش مشاكل حضرتك.
What are the elements of a clinical history? You have the personal history, presenting complaint, history of present illness, past history, drug history, family history, and social history. We're going to take every item and discuss it in details. First of all, the personal history. What are the items of personal history? You have the name, age, sex, marital state, occupation, residence, and special habits of medical importance. If this patient is a female, you have to ask about the menstrual history. Name. It's preferable to take the full name. Some patients have similar names. Age. Age is very important. Some diseases are common in young ages and others are common in older ages. Sex. Sex is also important because some diseases are common in females and other diseases are common in males. What about marital state? Is this patient married or divorced, a widow or single? Each point is very important because it's going to depend on what you're going to ask afterwards. If the patient is single or widow or divorced, you're not going to be asking about sexual history. But if the patient is married, then you're going to have to take a detailed sexual history and ask about offsprings, children, how many children does he have, the oldest and the youngest. These are important questions for the marital state. What about occupation? You have to know where the patient works because some occupations cause or predispose to certain diseases. A patient with asthma, for example, if you check, you might find that he's working in a place where there are a lot of dust, like in a cotton industry. Then you have the residence. Where does this patient live? Maybe he lives in a rural area, around farms. That's why he has allergies, or that's why he has a chronic cough. That explains why that patient is living that. This place may predispose to certain diseases. And lastly, the special habits of medical importance. What are the special habits? Is the patient a smoker, alcoholic, maybe on some drugs, drug abuse? So you have to ask this because this is very, very important. It's going to make a difference in your diagnosis. Each point in the personal history will add some information and surely will add to your differential diagnosis or putting some plans in your mind for the patient. Just I wanted to make you take care about a small thing. If this patient is a female, you have to ask about the menstrual history. You have to ask if she has regular menses and how long does it take, how heavy is this menses, does she take contraceptive pills, or if this patient is menopause. This will make a big, huge difference in your history.
سنة كام؟
أنا 81.
ربنا يديك طول العمر. وحضرتك متزوج يا أستاذ محمد؟
الحمد لله. حضرتك أنا متزوج وربنا رزقني بولدين.
ربنا يخليهم لك. وعندهم كام سنة؟
الصغير فيهم عنده 3 سنين والكبير عنده 7.
وحضرتك بتشتغل إيه يا أستاذ محمد؟
حضرتك أنا أصلا بشتغل في مصنع دهانات.
وإيه طبيعة شغلك؟
أنا زي ما تقولي كده ببقى واقف على الماكينة.
وحضرتك ساكن فين يا أستاذ محمد؟
أنا حاليا ساكن في عين شمس.
بتدخن سجاير أو بتشرب شيشة أو بتتعاطى أي حاجة يا أستاذ محمد؟
الحمد لله ربنا معافيك.
The next item is presenting complaint. How are you going to be asking about presenting complaint? You're not going to ask the patient, what are you complaining of? This sometimes disturbs the patient. You can ask, like, for example, what happened new today for you to come? or how can I help you, or what is the problem? Try to avoid asking, what is your complaint? In the presenting complaint, you're going to be writing the complaint in the patient's own words. You have to know that the patient is going to be telling you in a certain terminology, according to his culture, according to his education, and you're going to translate that afterwards in the history of present illness into medical terms. Let's give some examples. So this patient is coming to you and say that he has swelling of the lower limbs. As a medical term, this is edema of the lower limbs. So in the presenting complaint, you're going to write, the patient is complaining of swelling of the lower limbs. Another example, the patient is complaining of sore throat. Okay? You're not going to say pharyngeal pain. Another example, the patient has pain in his joints or her joints. Medical term, arthralgia. The next point in the presenting complaint is the duration. Duration is very important. How long has this complaint been going on with the patient? For days, for weeks, for years? This is very important because you're going to determine if this patient is in acute illness or a chronic illness.
قولي يا أستاذ محمد، إيه اللي جاب حضرتك المستشفى؟
حضرتك أنا عندي وجع كده في صدري وضيق في النفس.
من إمتى؟
الموضوع بقاله 5 أيام.
History of present illness. Let's put some ground rules before taking the history of present illness. The patient is going to come in 3 situations. Either this is a chronic patient who has other illnesses and his disease has started from years, a long time ago, say 30, 20, 40 years. So he's going to start talking a lot about his disease, how it started. So you need to know when to start and how to start and when to catch that complaint in the middle of your history. Maybe this patient is complaining of something that happened before the symptom that he came complaining for like a month or a year, so you have to respect that. And maybe this history started from that complaint. You have 3 ways to ask your patient. You have open questions, closed questions, and leading questions. What do we mean by open question? When you start asking your patient, you ask him, when was the last time you were okay? Or you were fine, or you were stable? Okay, he's talking about his complaint. So you're going to ask him, can you tell me more about this complaint? Try not to direct your patient to certain issues because you're going to be leading to yeses or nos that you don't want in your history. Close questions. Say the patient has started to give you details about this symptom and you need to verify or clarify some things in this symptom. For example, the patient is complaining of chest pain. How is this chest pain as a character? So he says, I have chest pain. Can you explain or can you describe this chest pain? It hurts a lot, doctor. Okay, can you tell me more about this pain? Is it pricky or is it stabbing chest pain? So you're going to have a character to close your question. If you fail in doing the open or the closed, or still the patient doesn't understand what you want, you can go to the leading question by asking, is this chest pain pricky or stabbing chest pain or heavy chest pain? Or a yes or no question. Do you have chest pain? If the patient says yes, okay, then you can go back again with open questions and closed questions. Take care. Some patients want to give you every single detail in a yes, so he can show you how serious he is in grief or how serious this disease is for him or the complaint. So you can care. You have to make sure that tell your patient that every single detail in the history will make a difference in the diagnosis. If you give me wrong information, I will have to make wrong diagnosis. Okay, let's go to the next step. Medical terminology of the system. Remember we said in the history, presenting complaint, it's going to be in the patient's own words. Now we're going to translate it into medical terms in a more professional way. What about the chronological order? When you ask your patient about a question, about a symptom, this symptom will guide you a certain system. For example, You have the gastroenterology system, you have the cardiological system, you have the respiratory system, you have the rheumatology system. Every system has its unique symptoms or unique questions to ask about symptoms. Some symptoms are common, like for example, chest pain. Chest pain can be in a gastroenterology sheet, can be in a respiratory sheet, can be in a cardiological sheet. But diarrhea, you'll only find diarrhea in a gastroenterology sheet. So when you start with your complaint, you have to determine which system you're talking about so you can lead in a chronological order to other symptoms and ask about them in details because you want to put a differential diagnosis or a final diagnosis in what you're dealing with. For each symptom, you have to analyze. What do we mean by analyze? When did this symptom start? Onset. Okay? Course. Was it a lot? How did the pain go? Was it increasing or decreasing or stationary? The character of this symptom, or how can you explain, or how can you say the symptoms are going with you? For example, if we have pain, we're going to say that the character is how the patient feels the pain. But if we have diarrhea, we're going to ask how the time, frequency, that's time, okay? The color, the amount. So each symptom has its own character. The site of the symptom, where is this pain? Okay, radiation. This pain refer or go to somewhere else? Like if you have a chest pain, did this pain go to your shoulder or go to your neck or go to the stomach? Association. What symptoms are always associated with this symptom? For example, the patient complains of vomiting. Okay? Does he have nausea? Okay, does he have diarrhea with this vomiting? Timing. When you ask about timing, when does this symptom happen? Maybe more in the morning or more at night. What about aggravating factors? What happens to make this pain come or this symptom come? For example, if this patient is in stress, then this increases the chest pain. If the patient sleeps, the chest pain goes away. For diarrhea, if the patient eats, he gets his diarrhea. If the patient doesn't eat, then diarrhea doesn't come. And lastly, the severity of this symptom. How severe is your symptom? When you collect all this information of the symptom, you're going to know if this patient is in acute case or is this symptom something chronic, and you can still get more information from other symptoms. After you're finished taking your symptom and analyzing this symptom, please check and make sure you covered all the symptoms of this system. After you finish covering this system, make sure that you covered all the symptoms of other systems and make sure that you fulfilled and see if there's any positive data to be added to your history or not. For example, if the patient is in the cardiology sheet and you know that this patient has a cardiac condition, you have to also verify that he hasn't any problems in his chest, and you have to make sure that he doesn't have any problems as regards his gastroenterology system, as regards the joints or bones, he doesn't have any problems. You have to cover all the systems. Before going back to the past history, I just want to remind you, in the history of present illness, make sure that your present complaint is in the history. Some of you will go on and hearing the patient and listening to a story, and then at the end you forgot to take details of that complaint. You took symptom details, analysis of all other symptoms, but you forgot to conclude your history with this symptom. So make sure that either you started with the symptom, the presenting complaint, or in the middle it was included, or maybe the story ended with this complaint.
أستاذ محمد، مهم جدا نعرف كل حاجة عن ضيق التنفس اللي بيحصل لك. ممكن حضرتك تقولي إمتى كنت آخر مرة كويس وإمتى بدأت تتعب؟
بص حضرتك، عشان أكون صريح معاك يعني هو الموضوع بقاله 5 شهور كده.
تمام.
كل شوية أحس بوجع كده وضيق في التنفس، يجي فترة ويقعد كذا أسبوع ما يجيش. بس أنا بقالي 5 أيام الموضوع مكمل.
ويا ترى ضيق النفس من أول ما بدأ جه فجأة ولا بالتدريج ولا بيجي ويروح؟
لا، هو يجي فجأة يقعد فترة كده وبعديها يهدى تاني.
تمام. ويا ترى إيه اللي بيجيبها وبتستمر قد إيه؟
بص حضرتك، هي في العادي تجيلي لما أنا أكون على ماكينة مزج الألوان. عشان بيطلع منها دخان كتير.
وايه اللي بيخليها تتحسن؟
بحتاج بعديها اطلع بره واشم نفس هوا كده والامور بتتحسن.
تمام. وفي حاجه تانية بتجيبها؟
حضرتك برضو لو قعدت مع زملائي اللي بيدخنوا برضو ساعات كده بحس بتعب.
يعني يا استاذ محمد انت بتشتكي من ضيق نفس بيجي فجأة في الازمات لما تتعرض لدخان المصنع والسجاير وتروح لما تبعد عنه. تمام. وايه اللي بتغير في الاسبوع الاخير؟
بص حضرتك، انا عندي زميل في العادي هو اللي بيشتغل على الماكينه دي، فهو بقاله اسبوع واخد اجازه فانا اللي شغال عليها.
وبتحس بايه تاني لما ضيق النفس يجيلك؟
حضرتك بحس كده بصوت تزييق في صدري وساعات بيجي لي كحه.
كحه ناشفه ولا معاها بلغم؟
لا حضرتك، هيبقى معاها بلغم بس بيطلع بالعافيه يعني.
كان معاها دم؟
لا حضرتك، بعد الشر.
بتحس باي حاجه تانية يا استاذ محمد؟
زي ايه حضرتك؟
وجع في صدرك مثلا او حراره او زرقان؟
لا الحمد لله.
طيب، هل كشفت او عملت اي فحوصات في خلال ال5 شهور اللي فاتوا؟
لا حضرتك، هي دي اول مره اجي المستشفى.
احكي لي ايه اللي حصل من 5 ايام وخلاك تيجي المستشفى؟
بص حضرتك، انا زي ما قلت لك كده الوجع كان بدأ، بس حتى بعد لما خدت اجازه من الشغل الوجع وضيق التنفس فضل مكمل معايا، وكان الموضوع يعني لا يطاق. تحس ان يعني روحي بتطلع مني، والموضوع ما هديش لحد لما جيت على المستشفى وادوني ادويه كده.
الف سلام عليك يا استاذ محمد. وشخصوا حالتك ايه يا استاذ محمد؟
حضرتك هم قالوا لي ان انا عندي ازمه ربو.
بتشتكي من اي حاجه تانية في صدرك
الحمد
او في
لله.
بطنك مع الاكل؟
مش حاجه معينه، لا.
طب في المفاصل او في الحركه؟
الحمد لله برضه التسليم.
طب في الاحساس في الوعي؟
برضه لا.
طيب تمام. رجلك بتورم او في وجع في جنبك اليمين؟
لا ما أعتقدش.
تمام.
Your past history. Past history has certain items. You have a similar condition. Has this happened to you before? Okay. Are you complaining of other diseases like diabetes, hypertension? Have you ever been hospitalized before? Have you ever underwent operations? Accidents. Have you ever been involved in accidents? Blood transfusion. You have to ask about this. It's very important for blood transmitted diseases and allergy. Taking every single point is very important because it can build up more information on concluding what you're dealing with.
انت قست الضغط قبل كده؟
قست حضرتك كذا مره، وكل مره بيقولوا لي ان انا ما عنديش ضغط ولا حاجه.
طب انت عندك اي امراض تانية او اتحجزت في مستشفى قبل كده او عملت عمليه او اتنقلك دم؟
ولا اي حاجه الحمد لله.
طيب تمام.
Drug history. Drug history is very, very important because when you know what the patient was on, maybe you might change the drug. Maybe that drug is causing him complications which led to his history or his complaint. Maybe he's taking the drug in a wrong way. Maybe he's on a therapy that you should, when you decide on giving another treatment, it cannot contradict with the drug he is on now. And you have to take a detailed history about drug allergy because if the patient has is allergic to certain drug, you have to avoid this in your prescriptions.
انت عندك حساسيه من اي ادويه؟
لا.
طب انت ما بتاخدش اي ادويه لاي سبب تاني؟
لا حضرتك.
طيب تمام.
Family history. You always have to ask, has this disease run in family before? And you have to ask of other hereditary diseases.
طيب يا استاذ محمد، هو في حد في العيله بيشتكي من الحاله دي او عنده سكر او ضغط او عنده اي مرض صدري او اتعالج من الضرن؟
بص حضرتك، انا على حد ما انا فاكر، انا والدي الله يرحمه
الله يرحمه.
كان برضو بيتعب من الدخان جامد وكان بيحتاج ياخد بخاخات يعني. طمنيني يا دكتور، هو انا محتاج اخد بخاخة او حاجة كده؟
ما تقلقش يا استاذ محمد، البخاخه دي حاجه عاديه جدا، ما تقلقش وهنتناقش فيها بعد الفحص.
Now we come to the social history. When you're talking about the social history, you're not actually taking it to build up more for diagnosis, but you're planning for a proper decision for this patient as management. It includes home life, education, relationships, sexual history, and substance misabuse. If you know all these items, you're going to know how to treat your patient. For example, if the patient, you're going to give him instructions about how he's going to be treated, that someone has to care for him at home, take care of him at home, then you have to make sure that he has relatives staying with him at home. Maybe he's living alone. So you have to prepare for something appropriate for this patient, so for someone to take care of him. Or look for an alternative instead of that plan you were going to put the patient on. What about education or culture? Some patients refuse a certain treatment or management because it's wrong in their culture. So you have to understand well your education of the culture of the patient. What about relationships? You have to know how you're going to follow up this patient, how you're going to deal with the patient. Is there any relationships that's going to make things difficult? Some psychological relationships, he has some troubles. Okay, maybe this relationship will affect his treatment. And lastly, the substance abuse. Of course, substance misuse is very important because it differs in the way you're going to manage your patient.
وحضرتك يا استاذ محمد بتقعد في الشغل فتره طويله ولا بتبات في البيت؟
لا حضرتك أنا عمري ما ببات في الشغل، ببقى قاعد في البيت.
تمام. ومراتك واولادك معاك ولا بيسافروا البلد؟
لا حضرتك هما دايما قاعدين معايا في البيت.
تمام. انت بتلعب اي نوع من الرياضه يا استاذ محمد؟
الواحد بقى لما كان صغير كان بيلعب كورة وكده، بس دلوقتي مش قوي.
تمام. ايه نظام اكلك يا استاذ محمد؟
عادي حضرتك باكل في البيت، يعني مش حاجة معينة.
استاذن حضرتك تقعد عشان نفحص ونطمن عليك.
Okay, let's summarize what we have said. You took your history and you sat with your patient and you listened very well. So you have to revise this history. Tell your patient that I'm going to tell you or verify what I heard and if I understand correctly. And please correct me if I understood or misunderstood something so I can correct it in my history taking sheet. Systemic inquiry. What is systemic inquiry? When you're dealing with this patient, after you finish your history, when you revise, you'll find some points that you want to verify with yourself and with your patient. For example, the patient was talking about a complaint in his gastroenterology system. But remember that he was a smoker. So maybe as a smoker, it affected his gastroenterology system. Okay? The patient complained of loss of weight. To make sure that this smoking condition didn't cause lung cancer that made him lose complaint, not that he just has diarrhea that made him lost weight. Another issue, the patient has palpitation. Palpitation usually in the cardiology system. Okay, but sometimes palpitation can be present in a thyroid condition. So you have to make sure that you cover palpitation in as a similar complaint in conjunction with other systems. After you finished all this, explain and clarify to your patient what you understood from the history. Explain the plan. Explain what he has, because this is very important for the patient to know what we're dealing with and how we're going to treat, and put the patient in ease that everything is going to be okay if he follows the steps or if he goes on the right way with you and listens and is in good compliance with you. If you explain to your patient very correctly what you're dealing with and how you're going to treat this patient, then the patient is going to be willing to go with you in the treatment.
طيب يا استاذ محمد، انا هراجع مع حضرتك اللي انا كتبته عشان نشوف في حاجه ناقصه وشوف انا فهمت كويس ولا لا. مشكلتك بدات من 5 شهور، بضيق تنفس، بتيجي وانت بتشتغل ولما تشم ريحه دخان، ومعاه تزيق في الصدر وبلغم قليل ومفيش دم.
مظبوط كده.
طيب. ومن 5 ايام ضيق التنفس عندك زاد ومش بتاخد علاج ولا بتعرف تشتغل.
بالظبط.
مفيش حراره ولا زرقان.
ولا أي حاجة.
طيب يا استاذ محمد، ان شاء الله خير. هعرض الحاله بتاعتك على دكتور القسم وهرجع اطمن حضرتك.
متشكرين جدا لحضرتك، معلش تعبناك معانا يا دكتور، وان شاء الله ربنا يجازيك خير.
ده واجبي يا استاذ محمد.
Remember, a good history leads to proper management. A good doctor and patient relationship leads to compliance. Compliance means that the patient is going to listen to you and he's going to do everything you want him to do. Good compliance and management will lead for sure to a better outcome. Thank you for watching. I hope you've gained crucial medical history taking skills that will aid you in your years to come. Good luck.